Hey, it's Dr. William Curtis. Today I want to talk to you briefly about the idea of managing cholesterol, and its relationship with heart disease and this type of thing. It's kind of prompted by a series of conversations I've had with different physicians, and also, the blogosphere, Twitter and Facebook, things like that. People are always talking about the role fat and cholesterol play in regards to heart disease and stroke. And I guess what prompted me on this is there's so much rhetoric back and forth. I just listened to a 4.5 hour podcast on the Joe Rogan show between basically a traditional low fat, anti-cholesterol a proponent, cardiologist, researcher, and a person that is more of a proponent of a ketogenic or high fat, low carb type of diet. They had some common ground in what they agreed upon, but for the most part, there was a wide difference near the end of the debate that even though there's research out there that says certain things, both camps couldn't come together. And I think the reason that is because there's several reasons. First off, not everybody's the same. Not everybody's genetics are the same. Not every diet is going to work for every specific person. I think it was in 2014, they had meta-analysis studies that showed that, for the vast majority, greater than 70% of the population, people can have, significant quantities of fat in their diet and it doesn't change their cholesterol. But there's a very small percentage of people that will. So that illustrates to us that fat and cholesterol and how they are related to each individual person can vary tremendously. But here's the thing I ran across that I just... there's so much pressure from a medical industry to, we have to do things a certain way for everyone. I call it herd medicine. Everyone that's a diabetic must be put on a statin drug. That's like the herd mentality. And, I know that, there's guidelines that are put in place because they feel that the evidence is overwhelming. Well, the problem is, you've got this guideline that says if you're a diabetic, you've got to be on a statin drug, right? So it's like you're a bad doctor if you don't put this specific patient on a statin drug. You get a ding against your management score, if you will. Well, as soon as you put that patient on a statin drug, another guideline pops up on your EMR system that says, by the way, doctor, have you checked that patient for diabetes? I noticed they're on a statin drug. So here you have a situation where you're being told, I have to put a patient on a statin drug, but at the same time, when I do, they're warning me that I have to be careful because that same statin drug causes the diabetes condition, or at least can lead to diabetes, which was the original reason I was told I had to put them on it to begin with. I don't have to be a medical doctor to realize that doesn't make a lot of sense. And there's people that are going to parse that up into small bits and pieces, and there's folks that'll define out why. But the bottom line, if you take that as a big picture, how much sense does that make? Second thing is, anecdotally, this is not a double-blind, placebo-controlled experience, but in my daily work, I routinely see people that come in that have low cholesterol, and they still have strokes, or they have heart attacks. And I have people all the time, throughout my 18-year career now, that come in and they have, I had a guy recently that prompted some of this conversation that it came in, had been treated with a statin drug in excess of 20 years, had LDL, the bad cholesterol, goal, they were at goal. And you have long track record of being at goal, according to the best guidelines we have for heart disease management. Patient came in with basically TIA type symptoms, transient ischemic attack symptoms, fortunately not a full-blown stroke, and on workup was found to have major blockage of the carotid arteries, the renal arteries, the peripheral vascular arteries, and also the heart. So had massive widespread vascular disease despite being on a statin drug for upwards of 20 years. And then when you put that out there and you talk to other physicians, well, that's just an unusual case, and it must be this strange paradox. It's not a paradox. We see this kind of stuff all the time. And the point I'm trying to make regarding cholesterol and cholesterol management, it's got to be individualized for people. These massive herd guidelines and stuff don't seem to make a lot of sense to me in some instances, because clinically, when you have a patient that's meeting all those guidelines and they don't get that benefit they're supposed to have, then what's the point? It's really difficult to decide in some situations. It's really hard to get behind that. So, I don't know where I want to go with this, but the point is, I think the conversations I've had with multiple physicians and, online folks here in recent weeks has just given me, it makes me really want to comment about this and make the point that, diet and lifestyle is what changes this. Clearly, heart disease, stroke, and even autoimmune disorders, we want to derail and talk about that. All of these conditions have, they're multifactorial. They're not caused by one thing. If you think that you're going to, statin drugs are going to save you from heart disease, I can give you dozens of examples of why that doesn't happen. I can give you even more examples of how a specific medication caused a person another problem they didn't expect. We need to spend more time in primary care, in my opinion, based on my clinical experience. We need to spend a lot more time talking to people about diet, specifically what works for that person. We need to spend a lot more time emphasizing to people, you have to be physically active. You cannot live your entire life inactive, ignoring the role of fitness, basic fitness, in the role in heart disease and long-term prevention. The research isn't unclear when it comes to that. We can argue all day about specific meds and side effects and back and forth and on and on and on. Why are we not more aggressive about actively pressing prescriptions for fitness, prescriptions for specific dietary modification? I think this is the thing that I think we should be spending more time on in primary care. Also, I think by engaging patients in that type of activity, we're going to be much more likely to get to the heart of what the other reasons that I think disease develops. And that's stress and spiritual issues basically related to stress. People are living these quiet lives of desperation, walking through, stressed out about their marriage, stressed out about their job, doing things they don't love to do. They have unresolved conflict with family members, and media stress and social stressors related to just constant bombardment of negativity. If you start asking, I'm talking, I guess, to primary care doctors or physicians, if you ask your patients, you will find out that a great deal of their problems are related to their social environment, how they handle stress. And when you have stress, I've written about this extensively on the NRG Tribe. Look under stress topics. Stress is a hormonal event. Unresolved stress, whether that's physical pain, emotional, social stressors, financial stressors, real or imagined, those problems raise cortisol. Cortisol causes your liver to dump sugar to prepare for fight or flight. When that occurs, your blood pressure also goes up. Sugar dumps into the bloodstream. Insulin has to rise, stores belly fat. That's what this hormone does. And in my opinion, that high insulin state, that high cortisol state, is the inflammatory state that leads to vascular disease, especially accelerated vascular disease. Why do some people get it younger? Because they're genetically more prone to it. Why do some people get older or never get it? Because they're just they don't have a greater propensity for that. So I hope walking away from this rant, I think, on cholesterol, fat, and heart disease management, statin drugs and everything, is just, I want you to walk away with a bigger picture. What are the things you can control? You can control your diet, your lifestyle, and how you handle stress. You can work to say, fitness is going to be a part of my life every day. I'm going to get up, I'm going to do some basic calisthenics, or I'm going to go for a walk, or I'm going to physically train for something. Anybody can do this at almost any age. With any level of health, somebody can be physically active in some way. You don't have to join a gym. The research is very clear that that is a benefit for almost all causes of death. In addition, diet. It seems clear to me from almost 20 years of clinical experience that my patients are not eating high-fat diets all day long and developing heart disease. They're eating carbohydrates. They're eating sugar. I do diet surveys, which I think is an anomaly for primary care, but I do very detailed diet surveys with my patients that are actually trying to prevent medical problems. When you look at their breakdown of their macros, we're always hearing this, but you better put them on a low-fat diet. They got to be on a low-fat diet. Let's go, Ornish style and put them on an all-vegetarian diet and all these type of things. People aren't eating that way. That's not what they're doing to develop obesity. And in my part of the world, I like to say that I live in the diabetic capital of the world, Nueces County and Texas. The reality is that that's not what people are eating. They're eating sugar. They're having liquid sugars in vast quantities, and they're having large amounts of processed carbohydrates. Yes, they have fats. Yes, they have proteins, and a few of them will have some vegetables in their diet. But the vast majority, I'm talking about the herd that's walking around developing obesity, high cholesterol, and type 2 diabetes, they're not eating a high-fat diet. That's not what their macros are. That's my clinical experience. Someone can argue with that. Someone can say, well, that's not my experience. That's my experience. So when I see that, and I see that they're struggling with high cholesterol, heart disease, diabetes, and they don't seem to have success by lowering fat in their diet, I tend to start to err on the side of, look, let's lower simple sugars in the diet and get rid of processed sugars. That means you can have good fats, eggs, nuts, seeds, coconut oil, butter, avocados, things like that. You can have, you should have all the non-starchy vegetables you want. You can have some meat. It's an omnivore type diet. It can be a version of a ketogenic diet. It could be a paleo diet as a baseline. But the idea is we need to look at why and what people are exactly doing on an individual basis and meet them where they are and make changes that are most appropriate. I have people all the time that come in with for my diabetic program, my Killing Diabetes program. I have people all the time that come in and you want to debate about whether they can eat a white potato versus a sweet potato, which is better. But that patient is still drinking Dr. Pepper every day. And I tell them, time out, stop talking to me about that. The primary problem is not whether you eat a white potato or a sweet potato. The primary problem is that you still have a liquid, high sugar, high glycemic impact product you're taking in on a regular basis every day. To wrap this up regarding, kind of started down the rant on cholesterol and statin management, the big picture I want everybody to walk away with is that we have this issue of heart disease. It's a big deal. And we have this growing epidemic of obesity and diabetes. We need, on an individual basis, if you're out there struggling with these conditions, look at what you're doing on an individual basis dietarily. Be honest. Are you on a high-fat diet or are you on a high-carb diet? If you are, let's try doing something different, maybe in line of what the things I've written about on my website, NRG Tribe, or that I've mentioned in this. Do a trial for a few weeks and see how things go. Try something different. Be physically active. I'm not telling you to go stop your medicines if you're on a statin drug. I'm not telling you that. You got to work on that with your doctor. This is a really complicated subject. But the point I'm making is I have very real experience with patients that it just doesn't seem like it makes a huge difference. It doesn't. Medicines, what you take out of a bottle, I think have less to do with your health than what you do, what you're physically doing. I don't think medicines save you in the end. I think that's the point. Medicines don't save you in the end. It doesn't mean you stop them. It doesn't mean you're not getting some benefit. Specifically, certain medicines do well for specific people. But my point is, why not get the most out of your health by doing the things, by changing diet, your fitness level, addressing stress in your life? Why not do those things and really make a commitment to do that in your life? Help your family members and your friends. Start talking about, let's do this together. I think that's how you change and reverse the health in this country. When I look back on this topic, on this video, I think it became a rant. I hope there was some wisdom that came out in there. I'm not telling anybody to do anything with their medicines. I'm not telling anybody to stop their drugs. I'm sharing one man's clinical experience as a physician in primary care in a high density, diabetic, high cholesterol, high rate of heart disease, peripheral vascular disease part of the country, part of the world. That's my experience. That's what I've seen. I see too many paradoxes related to these medications. I see too much argument, too many times when it just doesn't seem to fit the clinical picture. And one size fits all isn't going to work. We're going to have to do this on an individual basis, and we're going to have to do this with a more specific attention to what people are actually doing, not assuming what everyone else is doing. If you got any questions or comments, you can leave them below. I'll answer them as best I can. Take care and have a great day.